300,000. That's the number of Hoosiers on Medicaid who have just a few months to choose a new company to manage their health insurance.
Our 13 News State House reporter Emily Longnecker looked into that today. She's here to explain this change and what it all means. Emily?
Well, a little bit of an explainer here. In Indiana, the state does not directly pay every single doctor or hospital bill for Hoosiers who are on Medicaid. Instead, they work with, right now, 4 different companies that the state pays a set amount to each month per person on Medicaid. Those companies then work with the doctors and hospitals to set the cost for care. Think of them as like middlemen. Well, now the state has decided that one of those middlemen, MDwise, has got to go. The Family Social Services Administration, the state agency that runs Medicaid for Hoosiers, announced this week that come January 1st, the state would no longer be using MDwise to manage care for Hoosiers on the Healthy Indiana Plan and Hoosier HealthWise. FSSA said they were ending their contract with MDwise because they said out of the 4 companies that Indiana uses to help manage Medicaid benefits, MDwise cost the most and had the lowest quality. According to FSSA, Hoosiers who use MDwise can choose from 3 other companies to manage their care.
We're not concerned that people will lose their coverage. If anyone that is on MDwise right now, they're going to receive a letter from us, but even if they decide to do nothing at all, they're going to be auto-enrolled into a plan that's nearly identical to their own. And if they don't like that plan, they'll have 90 days to choose to a different plan.
MDwise expressed frustration about the termination of their contract with the state. They said in a statement, quote, "The state has chosen a rushed path that jeopardizes care for hundreds of thousands of Hoosiers." MDwise set to hold a virtual press conference at any moment to address some of these changes. We'll bring you what they had to say at 6. At the Indiana State House, Emily Longnecker, 13 News.